First and foremost, I think Adena understands its role to provide quality health care for our region, and I think they serve that need incredibly well here. But in the late 1800s, Adena filled the need for a hospital in our community. There were some tragic circumstances, a train wreck that happened here that led to the formation of the Adena Health System in our community. And, you know, all these years later, Adena is doing that again. They've stepped to the forefront to help renovate the Carlisle building to jumpstart the downtown economy. They're active and involved in our schools and in the partnerships that they have to grow our community. And they continue to try to push us to a stronger and healthier and thriving community that will, you know, have much greater benefits down the road than what I think we can even realize right now.
Our interest as in the health district, and I'm sure Adena Health System as well, is improving access to health care. And that's one of the big initiatives within our community health improvement plan that we were working together on. The idea was to help get people connected to their health care needs with the Partners for a Healthier Ross County, as well as Adena. You know, we're able to really dig down and find out what are the gaps in healthcare services. I think that's the value of the partnerships, is we all come together and we try to, you know, fill in those gaps by bringing in resources, bringing in funding through grants, or even getting programs started with some of our community agencies.
Relationships kind of formed there. As we started growing and working more together, I think we started exploring some different ways that we could work together. You know, there's some old history of we tried a midwifery program working together with Adena, looking at emergency room data, looking at urgent care data, trying to figure out how do we connect folks to primary care homes. We compared notes, shared data. They were able to do some geo-mapping with folks that had multiple ER visits and all across the county, not just in the city of Chillicothe. And we kind of started noticing that there was a density of those dots, sort of like a hot spot. Coincidentally, the Chillicothe City School District had a recently vacated elementary school there that they wanted to turn into a community center. So all the stars started aligning here, and we began working on that. I mean, now you've got convenient care that's close to home, right there in their own community. Some folks can walk, some folks can take the bus. You know, it's all within, you know, a 5-minute or so, trip. You've also got, not just acute care, but you've got well care available there, as well as chronic disease management that's available in that space as well.
I'm on the PORT team, the post-overdose response team, and Adena supports that heavily. And a couple months ago, we went to a house where someone had overdosed the week prior. And that person was not there, but we made a connection with the resident that was there, who also suffered from addiction. That person made an appointment with me for the next day to go to treatment. She expressed a concern to get into treatment and a want to get into treatment. And I showed up the next morning to pick her up, 9 a.m. as agreed, and no one answered the door. And my heart fell, and I thought, well, we lost her and we haven't even started. She had found another way to get there, but she had gone to the referral, and she entered into treatment, and now she's coming home. We all know someone who suffers from addiction. So any stigma is usually pretty easy to break through if you allow that person to try to make the connection that this is a human being and it could be one of your family members or friends. It becomes a lot easier to break that stigma.
Well, I'm Vanessa Escamilla. I'm a peer recovery supporter. Peer recovery supporter, short definition, is a lived experience with anything really, but in my case it's substance use disorder and mental health. Peer supporters tend to try to do is we connect with them so that we can provide them resources, get them treatment if they need it. It's me trying to give back. I'm in recovery now, so I want to show hope. I want to show that it can be done. I was in Chillicothe and they were having a town hall, and I knew I needed to go to it. I knew I needed to go to this event, and there I saw Dr. Gavis, and he was having a peer supporter on stage tell their story. And I was looking up there and I was like, I can do that. I want to do that. She changed her life. I want to be able to do that. And then from there, it was just like connection after connection. And somehow I ended up going to getting a job, making packets of different resources of all the treatment providers. I ended up in a HPP, Hope Partnership Project, council meeting. And I'm looking around and there are, members of this council, and I'm thinking, what am I doing here? How did I end up here? These are very important people. And they were very important members of Adena and the mayor and the judges and different members of different agencies and a whole collaboration of people that I had no idea cared about us. I had no idea they were doing all the things that they were doing for my community.
My role with Adena is sort of interesting. It's not a typical social work job. It has a lot of different components. Dr. Fetter, Dr. Lucky Do, myself, and Peggy Markham, who was a nurse at Adena, got together and created a program that would try to help these women. And it was an MAT program, medically assisted treatment program. We did give them Subutex, took them throughout their pregnancy on Subutex, and then once they delivered, we did a slow withdrawal off of the Subutex, so they ended up not being on medication at all at the end of it. So it worked really well. Our pilot group, we had 15 women, we had 16 babies, we had one set of twins. None of the babies withdrew enough to require medical assistance, and all of the women just tested for their medicine and nothing else, and none of them had an open case with CPS. So we were really encouraged by our results. These are great results. It was just sort of like a labor of love, but we loved the women. It was just fantastic. I think Adena as a whole just really is committed to helping them, to not judging them, to trying to get the best possible outcome for them and their child, and for them to be able to raise their child.
So I think what a lot of people don't understand about the Carlisle project was that fire originally happened in 2003. From 2003 to about 2010, the number of vacant storefronts outnumbered the number of businesses in downtown Chillicothe. So it was almost like there was a wait and see attitude to see, well, if something can get done with the Carlisle building, then maybe I'll be able to take my chance on my business, or I can renovate my building, or I can do something that has been my dream.
Just seeing that progress and living so close to downtown and seeing that fencing up for so many years and that construction zone, and touring these candidates that are coming in and interviewing with Adena and taking them through our downtown and being like, there's this, we don't really know what's going on. And then years later, being able to point out this beautiful iconic building in the middle of our downtown and always saying, I truly believe Adena is responsible for spurring our revitalization downtown, and that project inspired everyone else to do what we're doing today. It was really exciting.
To have Adena come in and invest in something, completely away from their hospital, from their building. They could have easily built something out there, but to say, no, we want to bring this back, I think was such a huge impact that it's had on our community. Since 2016, my business has extremely grown. I mean, that 2016 I feel was a big jump start for it, because I remember, again, it was October, I think, when they officially opened.
An important component of the skyline. I think the landscape of downtown really hinged on what happened to that building. If it's torn down and replaced by a parking lot, you lose a lot of the sort of the feel and the ambience and just a huge component of what downtown serves for people. We have a place where there's a lot of franchises, and those are equally important for towns, but I think a downtown can really set apart different communities and what makes it special. Again, because there was such a leap from people at Adena to say, this isn't our thing either, but we're going to invest in this place. Like, well, if people are doing that, then we'll figure it out too.
I think something we can all speak to is our children, and seeing that progression in our work goes a long way. Makes me emotional.
They're an essential community partner here in Ross County, being one of the largest employers in our area, as well as the central healthcare provider in our area. They have a real opportunity to either sit back and watch a community go, or they have the opportunity to lead in a variety of ways. And so if you look at the way Adena partners with schools, nonprofit organizations, local government, it's a really rich opportunity for Adena to affect the future of our entire community. Adena identified that diabetes was the #1 concern they had in Southeast Ohio. And so we partnered with them to bring the CDC's diabetes prevention program to Ross County. It was the first time that program had existed in this community, and we partnered with their physicians to be able to implement that and prevent type 2 diabetes in folks who were at high risk. From there, we launched into other opportunities. So we partnered with them with a pre-surgery optimization program for those who are about to have knee and hip replacement surgeries. That was a neat opportunity for our organization as a YMCA to exist in that preventative health space for folks who were about to see, a significant surgery in their lives. We continue to expand that to where we offer the Live Strong Cancer Survivorship Program, which is for folks who've been through cancer and how do they reclaim their health, reclaim their community connections, and rebuild their lives after that terrible diagnosis and treatment. We have a lady who completed one of our more recent Live Strong programs. She had faced cancer about 5 years ago, went through treatment through the Adena Cancer Center, and really battled through that. After she completed treatment, the Cancer Center had referred her to our Live Strong program. She went through that program, really was able to rebuild her health, be able to collaborate with Adena on all these different programs, to bring these programs to our community, and then as we go, spread it across our area where we share the region with YMCA's and Adena Health System.
My name is Jonathan Davis. I am the superintendent of Pickaway Ross Career and Technology Center. Adena Health System is one of our strongest community partners. Beyond providing supports for mental and physical needs to our students during the school day, they're also one of our largest supporters in regards to training of our students, as well as job placement, internships, and just overall support from the time they're in school through their healthcare needs and employment needs after school. It's whole child. It's from the moment we have a kiddo to when we disperse them back into the community. It's every part of what we're trying to do as schools. We're trying to reach students from an academic, a training perspective, but we're also trying to meet all of their social emotional needs. It's suicide prevention training, it's healthcare training, it's finding a primary care provider that lots of kids do not have, and the well-being for our school and our staff and our students in the community from that, it all came from the relationship we have with our healthcare provider, Adena.
Well, on behalf of our 768 members of the Chillicothe Ross Chamber of Commerce, we want to thank Adena for its incredible commitment to our community, its incredible commitment to our downtown, and we look forward to a future that includes Adena Health System and the rest of our community.